Hi, my name is Dr. Sumit Agarwal. I am a prosthodontist and implantologist, and today in this video I am going to be demonstrating you an impression technique for a case. We have a 40-year-old female patient with us from Delhi. She came to us. We had placed some implants in the upper jaw, but she is also a patient of oral submucous fibrosis, for which she got some we gave her some treatment for by resection of the bands on the cheek mucosa, by which her mouth opening improved from one finger to around 2 fingers. And now we have already done the implants and we are going to make impressions. Now for making impression in such cases, we cannot follow the routine technique, that is using a stock tray like this, perforated tray, and loading impression material in it and then making a pickup impression. So how to make impression in such cases where mouth opening is less? As you can see, the mouth opening is pretty less. The bands are there in the cheek mucosa. I'm not stretching, but if you can just take a glimpse. On the left side, we have already reduced some bands surgically, so that's why some mouth opening has happened. Earlier it was only one finger. बट ऐसे केसेस के अंदर इंप्रेशन लेने के लिए हमारे पास वी आर नो स्पेस टू इंसर्ट दिस ट्रे ऑल्सो. तो इसकी सबसे छोटी ट्रे भी ले लें, 0 नंबर ट्रे भी ले लें, देन ऑल्सो वी आर अनेबल टू मेक द इंप्रेशन. पेशेंट फील्स लॉट ऑफ पेन व्हाइल स्ट्रेचिंग. So how to make impression in such cases, that I will demonstrate in this video. So for that, what I'm going to do is that in this technique I'm not going to use any tray. So it will be a tray less impression. I'm going to be using some impression posts which are already screwed onto the 5 implants. You can say these are the impression posts, okay, and we have already placed them. I have taken RVG to ensure that the seating of the impression post is accurate. Now once that is done, what I'm going to be doing, I'm going to be using this simple hard wire which is having some aluminium in it. This is commonly available with the any hardware local shop, from where you can get this wire. After that, I actually did sandblasting of this particular wire. Now you can see that this wire is quite flexible, so I can adapt it onto those impression posts, and I will split these impression posts with the help of pattern resin. Now this is the pattern resin which I am going to be using. So the implants which I have placed in this in this patients are called DSI implants. These are 2-piece implants. They are fabulous implants from R-Line series. And what I'm going to be demonstrating in this video is I'm not going to be using any tray. I'm going to be using this wire. I'm going to fix this wire, adapt it onto the impression trays with the help of this pattern resin. And जब पैटर्न रेजिन लगा के अभी मैं इसको फिक्स करूंगा, उसके बाद फिर आप देख सकते हैं कि कैसे बगैर किसी इस तरह के किसी ट्रे की मदद से मैं इंप्रेशन ले सकता हूं इन अ सिंपल मैनर विदाउट एनी टू मच ऑफ हैसल. ओके, तो जैसे कि जस्ट आगे आइए. अभी मैंने इसको, हम देख सकते हैं इसको फिंगर से ही आप इस वायर को अडेप्ट कर सकते हैं. तो थोड़ी सी वायर मैंने अभी जस्ट अडेप्ट करी है. यू कैन सी दिस इज द वायर विच इज टचिंग ऑल द इंप्रेशन पोस्ट. Okay, so now I'm going to be splinting them with the help of pattern resin. With the help of 3-way air syringe, we are going to dry these impression posts first. We have this adapted metal wire which is flexible one, and now I'm going to be fixing this particular wire onto these impression posts with the help of pattern resin. So my fellow doctor is mixing the pattern resin. फोकस करो यहाँ पे, पैटर्न रेजिन दिखाओ जरा. दिस इज द पैटर्न रेजिन. दिस इज फ्रॉम जेसी कंपनी. सो आई एम गोइंग टू बी प्लेसिंग दीज पैटर्न रेजिन ऑन टॉप ऑफ. फोकस कर लेना, दिख रहा है? यस सर. So both from the buccal as well as from the lingual side, I am going to be adapting. मुख लीजिए. On these five R-line implants, we have placed the impression tray copings. These are open tray, and we have splinted them with the help of pattern resin using this wire. This is the wire which I have just told you, available in any hardware shop. This is flexible. Just use your pattern resin with your brush, and you can simply put pattern resin and do rigid fixation. So this is now rigid. It cannot move. It's totally fixed. So now I'm going to be using putty base and catalyst of addition silicone, where I'm going to be using in small chunks, and then I'm going to be picking it up. So I'll just show you without the help of any tray. We are going to pick up the correct 3D positioning of our implant. So putty impression material, here I am using addition silicone. You can also use condensation silicone as well. Okay. So here we have used this base and catalyst. First we are mixing it in small quantity. थोड़ा सा mix करेंगे, और इसको मैं फोकस करिएगा मैं कैसे इसको इंसर्ट करूँगा. आप देख सकते हैं कि ये पट्टी को मैं ऐसे धीरे धीरे मैं थोड़ा सा इस तरह से इम्प्रेशन लेने के लिए इंसर्ट करता जाऊँगा. इस साइड में भी ढीला छोड़िए प्लीज़, क्योंकि चीक का बहुत ज़्यादा प्रेशर है हमारे पास, तो इसलिए वी हैव टू गो स्लोली. सो एज यू कैन सी आई एम पुटिंग द पट्टी मटेरियल विद द हेल्प ऑफ माय फिंगर इन स्मॉल इंक्रीमेंट्स एवरीवेयर. Completely adapting the putty onto the impression post, both lingually as well as buccally, and also on the top. So now you can see I have placed putty impression material in small increments, and all the 5 extensions of my impression posts, they are exposed. So 1, 2, 3, 4, 5. This is 1, 2, 3, 4, 5. Now I will allow the putty to set, and then I'm going to be picking it up. So just now I have told you that the 5 implants, the screws are to be exposed, impression screws. So you can see this was the wire. Okay, so the first implant, second implant, third implant, fourth impression post, and this is the 5th impression post. So now we are removing the impression posts. So after we have removed all these screws, focus here, we have removed all the 5 screws, 1, 2, 3, 4, 5 from the impression. Now come here, we are going to be removing the impression material from the mouth. This is the retrieved impression. You can see the 5 impression copings are there. These are the 5 impression copings, and now we have to inspect this impression, that if at all some gaps are there between the impression material and the coping, then that can be filled with the help of this flowable composite. So over here we can see all these are stable. These are all stable. This is also stable, but since there is slight gap is there, so what I am going to be doing, I am going to be inserting small amount of flowable composite like this, just like in basal implantology. We can stabilize this impression post a bit more. This is already stable, just to fill the gap. That's it. This is light cured. इस पे light cure करके just a 20-second light cure will be enough. Just attaching the analogs with the onto these impression copings, and then we'll send it to the lab. The lab will fabricate the jig trial on it, and then we'll do the jig trial. So this was one impression technique which I use, and I recommend also to all the budding implantologists, that whenever you have less amount of mouth opening, or if you're not comfortable with the tray, or the patient is not willing for, if there is a problem that you can't make an impression with the standard tray, you can simply split these impression copings with the help of wire and your pattern resin, and then just you can pick it up with the help of this putty, and that too added incrementally. So this is one technique which helps us, especially in cases where you have less mouth opening due to oral submucous fibrosis or any other reason. I hope ये वीडियो आपके लिए थोड़ा यूजफुल रहा होगा, and I wish to bring you more videos like this in future. Thank you.